Well, in Australia, we have a very wide range of excellent health services, facilities, and providers. But in order to avail yourself of these to your benefit, you need to know where they are and how they find them. And also, please bear in mind that we have many older citizens who are not born in Australia, for whom English is not their first language, and who are totally confused when they have to try to get some essential information about a local health service off the web.
The most important issue facing people with disabilities in terms of healthcare services is the same issue that I think faces us in terms of the community generally, and that is the negative and limiting attitudes which the community has towards people with disability. And what we experience is the soft bigotry of low expectations, and so that flows into the healthcare system.
Improving healthcare services really requires us to value the individual and to give them opportunities to use their strengths. And when we do that, they thrive and the community benefits from it. So really the challenge for the mental health system is to actually re-engineer our responses so that they're around the person, and that includes families and carers. And then to focus on recovery, which really means that each individual gets a chance to direct their own recovery journey, to set their own goals for life and their own aspirations. To really improve services, we need to change the way in which people work together, and we need to adopt collective impact approaches. We have to somehow get ourselves out of the silos of government and ministerial responsibility, which often sees us working in isolation. The fact is 1 to 3% of the population live with severe mental illness, schizophrenia, bipolar disorder and similar disorders, and they have very, very poor health outcomes. They suffer significant discrimination. They often miss out on basic services, particularly, for instance, physical health checks for people living with severe mental illness, such that they're dying 10 to 25 years earlier than the rest of us. And they don't die of mental illness. They just die of failure to respond to their broad needs.
When we consider Indigenous health or Aboriginal and Torres Strait Islander health, we need to do so in a way that recognises what's already in play. We know the statistics, we know that, and the key statistics is that Aboriginal and Torres Strait Islander people die on average 10 years younger than the rest of the population. We can't just look at one aspect of health, we've got to look at what we call the social determinants of health, and for Aboriginal and Torres Strait Islander people and even minority culture peoples, we've got to look at the cultural determinants of health. Well, I think some of the most important considerations for healthcare in Australia really revolve around the quality of the workforce and the reach of the workforce.
The main barriers to people getting good health service are often regional, geographical. It can be just that there isn't the service that they need close by, and that's certainly true of newly developing areas like mental health. Well, Australians are enjoying greater longevity than ever before, and that's a wonderful thing. Australians are actually experiencing better health for more years than ever before. But Australians are also, in their older years, facing age discrimination, particularly if they want or need to have paid work.
Some of the significant barriers to achieving good health outcomes have to be around good health literacy in a language that people can understand and respond to. It's about a great population health approach and making sure that the community is given information and empowered to take control of their own health, because we've got to look at it from a holistic point of view. From an Aboriginal person's point of view, we see health, our physical health, our mental health, our social and emotional well-being all intertwined, and we see the whole person and how we fit into our environment.
I think the question that isn't asked more generally in the health system is what are the particular issues which you as an individual face? The system inevitably provides sort of packaged solutions which work for some members of the community but not for others. We need to have a system which is far more personalised. The rights and dignity of people with disabilities matter just as much as the rights and dignity of any other person in the community.
If there's a question that needs to be asked more strongly in the healthcare debate, I think it's what the individual should do for himself or herself. The basis of a person's health is a person's own choices. You can be unlucky and things just happen to you. But on the other hand, people need to take responsibility for themselves.
So justice health is very, very important. We know that many people who commit crimes in the Aboriginal and Torres Strait Islander community have very low literacy and numeracy capacity. And we just look at mental health of prisoners, and you say, gee, if you could really address that before they start to offend, we might cut down on crime, if that is one of the contributors.
We're not asking some of the big questions, and we really must. For example, why is it that someone living with a mental illness has their social supports responsibilities sitting within inside the health portfolio? Why wouldn't those supports sit within inside family and community services, which actually has expertise with individual and family functioning? We really need to look at that continuum of care, and I think there's an opportunity to really question why we wouldn't combine the whole social support system through the Ministry of Health and Family and Community Services into one organisation. There is much in all of this discussion to really challenge the best and most creative minds in government, academia and the community. And let's face it, a lot depends on it, lives depend on it. As a civilised society, we can and must do better.